Welcome to Ortho Reports podcast. So, what does it really take to rebuild a knee from the ground up? Today, we're diving into a fascinating case report that showcases a surgical breakthrough for one of the most devastating injuries you can imagine. It might just offer a whole new blueprint for how we fix the human body. Let's get right into it. So, let's just frame the problem here. I want you to imagine a knee that's been so badly damaged, its main support structures are just gone, completely torn. How in the world do you even start to reconstruct that? Especially when you've got other major complications working against you. That's the challenge we're looking at today.
But before we get to the really clever solution, you gotta understand the sheer scale of the problem. This isn't your typical sprain or sports injury. We're talking about a level of damage that even seasoned orthopedic surgeons call devastating. The technical term for this is a multiligamentous knee injury, or MLKI, and it's basically a catastrophic failure of the knee's entire support system. Think of your four main ligaments as the knee's primary support cables. In an MLKI, at least two of those cables have totally snapped. Now, there are a few ways this can happen, but the most common pattern by far is a tear of both the ACL, that's the one that controls forward movement, and the MCL, which gives you stability on the inner side of your knee. When you lose both of those at once, it creates this massive, destabilizing problem, and that's the specific challenge these surgeons were aiming to solve. So, how does an injury this bad even happen? Well, the causes are usually pretty traumatic. We're talking high-speed car crashes or those really intense forces you see in sports, sudden, sharp pivots, violent hyperextensions. And the source material makes a really good point. With more people playing sports and, frankly, more cars on the road, these devastating injuries are actually on the rise. Okay, so the problem is already tough. We have a severe, complex injury that's hard to fix on a good day. But now, let's throw a real wrench in the works. For patients who have a high body mass index, or BMI, this already difficult surgery gets a whole lot harder.
And the challenges here are huge. You see, a higher BMI isn't just about more weight on the joint, though that's definitely part of it. It actually increases the compression forces on the brand new repair, it can slow down muscle recovery, and it leads to a much, much higher risk of the graft failing or the patient getting hurt all over again. It just makes getting a successful outcome that much more difficult.
So what do we have? A severe injury made even riskier by a high BMI. And that brings us to the really innovative solution in this case report. This is where the whole approach to reconstruction kind of gets flipped on its head. The procedure is called the modified Linz technique, and what's so brilliant about it is the philosophy. Instead of just replacing broken parts with new ones, this is a biological approach. It's all about working with the body's own anatomy to create a repair that's stronger and better integrated. It's actually pretty elegant. Here's how it works. First, instead of completely detaching the tendon they use for the repair, the surgeons leave its original connection to the shin bone totally intact. That's key. Second, they carefully reroute that tendon so it perfectly mimics the path of the original ligament. And finally, they lock it all in place using modern adjustable loops that provide way better stability than old-school screws. And this quote right here from the paper itself gets to the absolute heart of why this is such a game changer. By keeping that original attachment, you preserve the graft's natural blood supply. And what does that mean? It means faster healing, a stronger final repair, and a truly biological reconstruction. That right there is the secret sauce. Okay, so it's a really clever idea on paper, but does it actually work in the real world? Well, the researchers put this technique to the ultimate test in a clinical setting, and they used the exact high-risk patients it was designed to help. The study followed 5 patients, and get this, their profile was a perfect storm for this kind of challenge. Every single one of them had severe, chronic tears of both their ACL and MCL, and every one of them had a BMI over 25. I mean, this was the definition of a high-stakes test for this procedure. So, what happened? The results were nothing short of remarkable. Now, surgeons use these standardized scores to grade how a knee is doing. Think of it like a report card for function, stability, and pain. Before the surgery, the average Lysholm score was about 66, which points to moderate disability. Afterwards, it jumped to almost 92, an excellent score. The other score, the IKDC, was even more dramatic, leaping from 45 all the way up to nearly 98. These are not small gains, people. This is a life-changing level of improvement. And this chart just puts that story into stark visual terms. You can see it right there.
The patients went from a state of pretty significant impairment to a score that's considered excellent. That's their recovery, right there in 2 bars.
Now, for anyone out there who's a little skeptical, or maybe you're into statistics, this is the number that really matters. It's called a p-value, and it tells you the probability that these results happened just by random chance. A p-value of less than 0.001 means there is less than a 1 in 1,000 chance that these incredible improvements were just a fluke. This is the statistical smoking gun. It's proof that the technique itself worked. So when you see results this strong in such a challenging group of patients, it naturally leads to a huge question. What does this all mean for the future of orthopedic surgery? Could we be looking at a new standard of care here? The study's own conclusion really says it all. The authors call this technique a reliable and effective option, specifically for this high-risk patient group. By preserving the body's natural biology and pairing it with modern technology, they were able to unlock better healing and a more anatomically perfect reconstruction. And that kind of leaves us with one final, much bigger question. I mean, we just looked at one very specific knee surgery, but the principle behind it, this idea of preserving the body's own biology to get a better result, that has implications that go far, far beyond the knee. Is this biology-first approach the future of how we solve our most complex surgical challenges? It's definitely something to think about. Thanks for tuning into this explainer.